maybe we focus a lot on mothers because maybe they have quite a lot of predisposing factors or triggering factors in comparison to when we look at grandma, when we look at dad. I think they have more protective factors in comparison to the mom. Maybe that's why we look too much into the mom.
Welcome to the Mom's Mental Oasis, the show that explores maternal mental health, motherhood, and parenting. We are all about nurturing, supporting, and educating because we know that when we know better, we do better. I am your host, Molen Makotingobeni, and it is a pleasure to have you here with me today. If you are new to our channel, I welcome you, and I still ask you guys, please subscribe. By subscribing, you are growing our community and keeping us here. And if you've been with me for a while, thank you so much. I appreciate you. And today we are having a continuation of our awareness, and we are talking about the big man, or maybe I should say the big woman. And that is postpartum depression. And for this episode, I thought, okay, let's make it more educational and get ourselves a clinical psychologist to the studio to speak with us about postpartum depression, so that, as I always say, that when you know better, you really do tend to do better for yourself. And today, the lovely guest is Lerato. Hi, Lerato.
Hi.
How are you?
I'm well, thank you. How are you?
I'm good. Thank you so much for coming through. And, before we get... Well, I know Lerato from my mommy club through someone at work who brought her through. So, you know what? I've known her in a series of ways. But today I'm talking to the professional. So I want her to take the stage and talk to us and tell us who you are to the viewers.
Hi, Tira's viewers. I'm Lerato Mohale. I'm a qualified social worker and a qualified clinical psychologist, currently working in private practice. And thank you for having me here.
It's always a pleasure. So, as a mom, I'm sure you've seen people come through with mental health issues. And moms, most of the times, I feel like we always have this armor of, I gotta keep it together. I gotta be, because if I fall apart, everything falls apart. It's that mindset. And I think sometimes because of that, we really don't understand as women in general, when we go through those stages of, having a baby, and then now the baby's here, then now everything, there's so much changes that are happening in us as women. And I think right now, most people just always presume everything is baby blues. And, they never really get the idea of how to postpartum depression is also something that you could think about. Maybe you could start us there by, showing us the difference between the baby blues and postpartum depression.
And as you're speaking, I find it interesting that you're wearing a blue.
I'm wearing a blue. It's my color.
Okay. So very interesting that you state, we have the baby blues, the socially termed baby blues. And then we have what we call postpartum depression. So with baby blues, we're looking at, I could say, a state or a stage in which there is disruption in your mood state. There's a bit of dysfunction in your mood state. It can occur within a few days after giving birth, stretches out to about a few weeks, right? And it's characterized by symptoms such as being irritable, being exhausted all the time. You are tearful, you are tired, you want nothing to do with anything. But you still love your baby. You are still able to make meaningful connections with your baby. You are still emotionally attuned with the baby, right? On the other hand, we have postpartum depression, where now it's not only that phase or state, it's actually a mental health condition. Okay. It's serious, right? So we're looking at symptoms. It's general symptoms of depression. However, because they usually occur post giving birth in most cases, that's why we say it's postpartum depression. So what are we looking at? Symptoms such as persistent sadness. And this is where we need to make a differentiation between baby blues. It's sadness here and there. It comes and goes, or it doesn't stretch for a long period of time. But with postpartum depression, it's persistent. And we're also looking at an irritable mood, which is going to last for a long period of time as well. We're looking at poor motivation. You don't want to get up and bath. You don't want to bath the baby. You don't want to feed the baby. You see this lack of motivation. We're looking at hopelessness, feelings of hopelessness. You're looking at helplessness as well. And we're looking also at appetite changes.
Yeah.
And this one is tricky because appetite can change after giving birth.
Yes.
So if it stretches out for a long period of time, that's when you need to say, okay, maybe something's wrong. And if there's appetite change, there's obviously going to be weight change.
Yes.
So some mothers can eat a lot and gain weight.
Yeah.
Others can eat less and lose weight. We're also looking at sleep disturbances. Very important to know that with a new baby, of course, your sleeping pattern is going to change.
Very drastically.
Right?
I love I can preach.
So, but the difference between baby blues and PPD is that with the baby blues, when a baby is sleeping, you can say, okay, let me take a nap. And then you do fall asleep.
Yeah.
But with PPD, even when the baby is sleeping, there is still those sleep disturbances. So because with sleep disturbances, we're looking at excessive sleeping, or we're looking at insomnia. So with excessive sleeping, a mom who is depressed could sleep so excessively that they don't even care about the well-being of the child. And then we're looking also at insomnia. So even when the baby's taking a nap, you don't
want to.
So we can see, no man, this is more of a condition, right? And a very significant symptom, again, that differentiates the two, it's suicidal ideations.
Yeah.
A mom can feel like, you know what, maybe it would be better if I died. And homicidal ideations, where a mom starts feeling like, maybe I can just harm the baby, you know. With normal baby blues, it usually doesn't happen. So that's how we can differentiate the two.
It's like a state, like as you were saying, just a specific state, because the transition itself from, after pregnancy to motherhood is very different because lack of sleep. It's like the thing, you don't sleep enough, and then but it's, I like that you point out that even still, of all those changes and transitions that are happening to a mom with the baby blues, you still want to connect with the baby, which is your, that sign in your mind. You must go like, something must be wrong when I don't want to do at all. Because at the end of the day, there are misconceptions when you think about it, with PPD as well. And I think the most general one is just, it's just a phase.
It'll go away.
It will go away. It will pass. So which one do you feel like needs to be highlighted the most that the viewers should know about?
So like you're saying, especially in Black communities, because mental health is still something that we need to psychoeducate about. We would say, it's just a phase, it will pass. But, and thank you for asking this question, because there's also a distinguishing factor. With baby blues, it's a phase. It passes.
Yes.
It's like by a month, you even forget about that. But when it's PPD, we diagnose depression from at least 2 weeks. The symptoms must have been there for at least 2 weeks. So when it's been 8 weeks and you're still feeling that way, it becomes questionable. So it's not passing. It's not a phase. It's not passing.
It's a misconception.
You see? So it could go as long as 3 years if left untreated, and it can be compounded by other factors as well. And another misconception, very important, is that PPD affects bad mothers.
No, but that's the thing, because everybody's mindset is good mother. You're a good mother. It's the general thing. Everybody has to be a good mother. So the moment they start doing things that are, unnoticeable or noticeable as not good, you're a bad mom. But you don't realizing that it's a misconception. There could be some issues there.
Thank you.
That's a good point to talk out.
So it's a misconception and a myth, because PPD can affect even the best moms. For instance, maybe somebody is having their 4th child. They've been a present, good, attuned mom for the past 3 children. And for some reason, because of life changes or whatever, then suddenly when it comes to the 4th child, they get or they experience the onset of PPD. So are we going to say you are a bad mom to this one, or life is just happening and it's influencing the development of PPD?
Yeah.
So we need to be very conscious of how we speak about mental health affecting people.
Yeah, because the other thing actually, which is, well, I recently learned about it as I was reading through, that the other misconception is it only happens to the mom.
Very interesting.
I was like, okay, I never thought that. No, because it's true. I feel like as much as we really do, like we having these present dads, we don't really take the mental health as seriously as we do with the mom. And reason being that, generally speaking, the mother takes the bigger load.
Yeah.
It's just factual. But it doesn't mean that they don't experience it. And I think that's one of the misconceptions. I was like, okay, I never thought.
Yeah, very interesting as well, because it does affect dads. It does affect grandmothers or other caregivers that are involved in the rearing of the child. I just feel that maybe we focus a lot on mothers because maybe they have quite a lot of predisposing factors or triggering factors in comparison to when we look at grandma, when we look at dad. I think they have more protective factors in comparison to the mom. Maybe that's why we look too much into the mom.
Okay, that's a good point. And then what are those risk factors that we don't see in other caregivers compared to the moms?
Very interesting one. So maybe when we look at the causes or the etiology of PPD holistically, maybe let's look at it from a biological, psychological, social, and spiritual factors.
Which no, those are really important factors to think about. They affect the mother's whole being. Yeah, no.
So let's start biologically. From a biological standpoint, and this is where I feel fathers can be a bit more protected.
Okay.
Because hormonal changes during pregnancy, like women struggle with hormonal changes when they are not pregnant during the menstrual cycle.
PMS.
So already,
guilty.
You see already, so hormonal changes, they predispose them to that.
Yeah.
So for instance, if a woman falls pregnant with unbalanced hormones, they go through the pregnancy with unbalanced hormones. What are the chances that even after birth, the hormones are still unbalanced?
Which is very high, yeah.
So already the foundation has been laid for mood disorders. We also look at heredity. Yeah?
I know. You got it from someone.
You see?
Your mama.
Your mama, your grandmother, uncle, whoever. And again, I will reiterate, maybe that's why we focus more on women. Because mood disorders, scientifically, it has been proven that mood disorders affect women more than men. So already with depression and anxiety, women are more susceptible to developing them in comparison to dad.
Yeah.
And we are also looking at, on the biological side, maybe pre-existing conditions. Maybe you were depressed even before you fell pregnant.
Yeah, I know that friend. Yeah.
Number two, maybe you have a pre-existing medical condition, your diabetes, your hypertension.
To be a woman, yeah.
So already, you are dealing with a lot even prior to pregnancy. Or some I know they develop during pregnancy and then you carry them with you after birth. But now you have to deal with quite a lot with a medical condition.
Yeah.
HIV as well. A big one.
Especially when you find, I've seen that when a woman finds out their status, ANC, whether you've been, and you don't, you yourself are shocked. I don't, we don't react when we're there, but you think about it, like this woman's probably been so faithful to this man.
Exactly.
And then now she finds out this. It's a lot.
And especially because I know in public clinics, they test you immediately when they test pregnancy. They test.
There's no debate there.
And then now today you find out that you're pregnant and you find out that you're HIV positive.
Like that's a lot.
So already it predisposes you to, you might be depressed even after giving birth to the baby. So some of those biological factors, right? We move to the psychological factors. women, we know we live in South Africa with a high rate of GBV, childhood traumas, sexual assaults, abandonment wounds, they already predisposed a girl child to mental health conditions. So if you've been through those type of traumas, chances of you developing mental health conditions later on in life are high.
Very high. No, but I always say, before you, and I know people, the idea of having a child is beautiful. Like, I don't dispute that, but I always say don't have a baby if you don't fix yourself. I know, it's like, I always say that because I feel like you carry so much, and the moment that child comes through, they will trigger you. And just to think about these women and all these things they are going through, and they haven't really figured out that space to themselves. But as I say, knowledge is our power.
So yeah, those type of traumas and all that, psychologically also, this one would belong to an individual. How is your psychological function? For instance, perfectionistic individuals, and they would exert so much pressure on themselves within the motherhood space, and maybe feel that they are not doing enough.
Yeah.
That type of pressure can also increase levels of stress, and stress is a building block of depression, obviously.
Very true.
And then psychologically also, we can look at your relationships, interpersonal relationships, which also will link into the social one. Or how is the marital system? Are there emotional connections? Are there supports? Like I'm saying, it then links to the social one, where we're looking at how is the marital system or boyfriend and girlfriend system? It brings us back to that biologically. You just found out that this person infected you. Maybe you want nothing to do with them. You guys break up. Now you are on your own.
Yeah.
The thought of being a single mom, you never planned to be a single mom.
Yeah.
Then how do we say you are a bad mom when you suddenly get depressed after giving birth to a child?
Yeah.
The factors are there. They are contributing.
Yeah.
On the social, also very important within the South African context, poverty.
It's the state of the country. It's the reality that we are living in. That's the reality.
Yeah, falling pregnant, raising a child in cupcakes economy is extreme sport.
It is, and alone, it's not for the easiest people.
It's not, Wawa. So you have to worry, stress about what are you gonna feed the baby? Do you have basic necessities for yourself and all that? Also, family conflicts. If you're still staying at home, how are they affecting you during pregnancy, after pregnancy? Would they be saying, "Oh, uhana utsana skolo but uyimile"? Those kind of things. Or now you are pregnant with baby number 3, but the realities of life.
Yeah.
Of course, they will contribute to the development.
Yeah. It's like a lot.
It's overwhelming. Eh?
No, it is, because you know what? When we speak from privilege. And then when you start really looking at other people who are not as privileged as you kind of feel like, that's such a load to carry for a woman, and then you have to raise a child. And then that's why I feel like having access to mental health services is so important for the mom. Yeah, sorry,
it's highly important. And okay, maybe we can move to the biopsychosocial spiritual, the spiritual one, which I feel is also an interesting one to include. We are looking at people's religion, falling pregnant as a teenager out of wedlock. That can evoke feelings of anxiety, of depression. With religious people, what are they gonna say at church? What are they going to say at home? I've embarrassed my parents, those kind of things. And maybe looking back at this theory, the psychological theory of Freud, the ego and superego. Some people have a very strong superego, and the superego functions as the moral compass. So if you have a very harsh superego, you're going to judge yourself quite a lot, criticize yourself quite a lot. And what happens when a person gets criticized quite a lot and all that? They develop guilt, self-blame, depression sets in. Yeah. So also that. And I thought of another interesting point on the spiritual one, because some people are more into African spirituality, right?
Yes.
So we're looking at, there can be some spiritual practices that are maybe imposed onto the new mom. Maybe they're recently married, they get into a new family, the in-laws, and maybe some practices are imposed onto them and they do not feel comfortable with them, but they do them, or they refuse to do them, and conflict arises. And just like that, it can form a foundation for postpartum depression, because you just want to raise your baby. But now they're saying, name that baby ka mama, and you don't want that.
The pressure from family. No, but pressure families, it's there. It's there. And sometimes it makes me wonder, Hore, then maybe that's why we have all this. When we think about it currently, we don't have the same social support that we used to have back when our parents had kids. It's very different from how we are now. Some are working moms, some have kids under severe, horrible experiences, as we spoke about the traumas. And now, how do we then now get to the point that are we then looking at actual depression, or are we looking at issues within our society that's causing women to have these issues? Can it be one thing, or it's a separate thing?
I think they are interrelated. We cannot separate them. And like you are saying, there are so many societal issues that are happening, and they contribute to the development of depression. So maybe then, if we want to look at how can we reduce the prevalence of postpartum depression, which it's a bit far-fetched because there isn't much that's been done on the ground. But then we can deal with the societal issues. There isn't much we can do about inheriting Ginsta mental health from Gogo or whoever, right? We can go to therapy as women, prepare ourselves on the psychological part. We can prepare ourselves to have children. Also, we can do proper assessment of potential fathers.
No, it's true.
You see?
Somebody was saying, Hori, you must be, I always tell my sisters that you really must be greedy with your eggs.
What one?
Not everybody deserves them. And that's just something we have to keep telling our young girls and other moms who are still thinking about that. You have to. And I think I like what you're pointing out, because then it comes to a point where even if you don't want to have a child, you must make that space for yourself to be okay with that. And make people see, it's fine. I don't want that. Our nurturing ways is very different. And I feel like that is okay. And that's kind of important to make those spaces.
So already, if then we can also manage our health. We eat healthy, we exercise and all that, to at least work on preventing other medical conditions, right? And then we work on ourselves, we go to therapy, we choose partners with caution. But the truth is, poverty is still there, unemployment is still there. You can get married to an awesome partner, present father, and then you lose your job. And then we know the statistics of unemployment in South Africa. So with all the other parts covered, you can be hit by unemployment and then a trigger that depression. So they are interrelated, whether we want it or not.
We can walk away from them.
Yeah.
And then when we go now to the moms, like you spoke about, so sometimes maybe some mom right now is watching it thinking, oh, but maybe I'm just exhausted. That's why I feel like I'm depressed. How can they differentiate between actual depression state and depression? I think you can also align with the other symptoms you spoke about when you differentiate baby blues and postpartum depression.
So very well, going back to the symptoms, how you will differentiate is with baby blues, it's the exhaustion, it's the tearfulness, the irritability. Also, we're looking at to what extent do they stretch for a few days, a few weeks. Then you've adjusted, you are fine. But with actual PPD, it stretches for more than 2 weeks.
Yeah.
You can feel it's been 10 months. My baby is even starting to crawl, but I still cannot attach to this child. I still feel like I could just poison this child. You can tell her, no, man, this is more than just baby blues. It's on a different level.
Nah. Then what would you say to a mom who's going through that, who doesn't know anything about it, but is scared of, can I make that move of getting help? Or can I actually, even getting help is a big step. Can I speak to someone about this? How can they, start that big step of just talking about their feelings to someone about this?
So if you have a emotionally attuned partner, you can start there. And in relationships, our knowledges are not the same. Our understanding is not the same. Maybe you are not so big on mental health issues. Maybe your partner is. And they could possibly spot her my partner is not fine. I think this could be bordering on to depression. They can support you in that regard, right? Family and friends, like I'm saying, we are both in the mental health spheres and our other friends. So if somebody who's not knowledgeable about mental health was to have conversations with us, they could gain out, okay, maybe it's depression or what.
Yeah, I see.
Family as well. With family, it's that issue of providing social support. Some might not be knowledgeable about mental health, but they could provide social support. They could also assist with other duties in the home that can help alleviate the stress, the
load. Yeah.
You get that?
Yeah,
right?
I understand.
So at least they can cook for you, wash clothes for the child, at least inyana. Yeah.
So then sounds like, if you can be able to see the signs earlier on, that it will be a startup for you.
I highly agree. And it's very important that I wish like most women, or if not all, can know the signs so that they can see, Mara, I meet 5 to 6 symptoms already. I can be diagnosable. And early intervention is very important, not only for the mom. So for the mom, the importance is you get treated as early as possible. It doesn't become chronic depression. And also it doesn't lead to, because when it's chronic, it can also make you susceptible to more anxiety. Or postpartum psychosis.
Yes.
So when you get early intervention, it protects you. But also very important, extending to the child. Because when you are depressed, you don't want to connect with the child. You don't want to feed the child and all that. What it happens is that it will create that attachment rupture. So your child, 20 years down the line, they'll be in therapy saying, my mom did this and that. My mom didn't, You now have passed on whatever you had onto your child.
Onto
the child. So it's very protective to the child as well. Yeah.
And I think you pointed out, Tore, families, they play such a huge role when it comes to support. But now let's talk about moms that don't have families. Moms who've decided to live in another province and, you are having this, you're having your career, then it happens. You start your family, but you don't have your mom there. You don't have your sisters or your cousin. How do they get to start with the idea of support, and where can they, begin their journey with it?
Okay, so partner number one support. If your partner is not your number one support, I don't know.
we need to loud, dads, you're hearing this. There's no debate. You're the first contact of everything.
Please,
you're the first contact.
So baby must be number one. Number two, if you already have elder children, at least they can also provide some support, or when teenagers, young adults, friends, very important. That's why there's this preaching of do have a life outside marriage, do have a life outside relationships, because this is where the friends come in and say, let's go to a lunch date, all of that. I get. Also, you can seek out professional help. You can say, let me get myself a registered counselor, a psychologist, a social worker. Let me consult. You can do that. Also, there are support groups. Mara, sometimes it's difficult to find them because you wouldn't know where to look. Mara, when you go for professional help, they probably know other networks to say, oh, you are in Pretoria North. I know a group. They have a session every Saturday. Let me connect. You see, then you get support, which is so meaningful that everybody is dealing with little ones. They understand your stress. You guys sit there and debrief and support each other.
And I also like that social media now, like, especially if you're following the right, like you were saying, when you're following or when you're speaking to the right people, they get to connect you to other groups. And mom clubs are really nice clubs to join as well. And like you were saying, Hore, when you speak to a professional, they will direct you to groups that are very helpful. And that's where you'll start having your support. It will start there. It doesn't need to be, maybe that's the thing. We always want something to be grand. No, but honestly, if you think about it, we always want everything to be grand. And when something is just simple, our mind just gets blown away by it. Sure, but to be a mom, to be a woman. No, but as well as the other thing you were pointing out is, the one thing about motherhood that I feel like it also contributes to other women having PPD is the mourning of who you were before the child. And I feel like that's a very important thing for us as, women. Besides the title of motherhood, I feel like we lose who we are as a woman. And I feel like that's something, maybe it contributes to the mourning of, your life and the startup of your depression.
A very interesting point there. And it takes us to, the psychological aspect of what would cause depression for women. Also, let's link it with biological, because now there's body changes, physical changes, the boobs start sagging, stretch marks on the stomach. So when you look at that child, you're like, you are the reason for that. Do I want the blaming of the child and taking away of affection and emotional connectedness, and also identity issues, like you're saying, Hore. Now you start mourning who you were before you became a mom.
Yeah.
Some would experience existential crisis, or, but what am I doing? Like, what's happening? What's happening?
Yeah.
So I think in that case, one can explore a therapy that is more into personal development, where you want to refocus on, okay, I'm a mom, my goals have changed, my life has changed. How do I adjust to this new role without losing myself in the process?
Yo, that's a very interesting thing. And now we're coming back is, I think I've asked this one about, okay, one of the things for my year is intentional living. And I feel like us as women, and then us being a mom, that's a very big, huge step for moms to take. So what do you think can be an intentional approach for mom to do to start up her support system?
Okay, very interesting one. So assuming that the pregnancy was planned, I think within that process, you start thinking, life is going to change. I won't have the same amount of time I had prior to that. And when the baby is here, what do I want to focus on? Do I want to spend more time with other moms? For instance, if you're a first-time mom especially, do I want to start spending more time with other moms? The same way, I've seen this trend of new makotis on social media, where they start spending time with new modern makotis. It can be that for you as well as a new mom. And also looking at, this baby is going to take a chunk of my time away. With the little time that I'll be left with, what do I want to do?
Yeah.
Which is going to be very difficult for our generation, because we are career women and we are present wives and present jobs.
We with the jack of all trades.
You see? So it's going to be very difficult. But I guess one can do what they can with what they have.
But yeah, I guess also the other thing that's very important, which is what I'm teaching myself, is that I can have it all, just not all at once. And that's
perfect.
That's a tough one to do, because now it makes me think about when you do trade-offs. I don't know if you know this concept of trade-offs. I want to align it into moms when it comes to getting help. Okay. So with trade-offs, it means that you decide that, okay, you're going to choose one part of your life that you're going to be good at.
Okay.
In a point where one part is going to fall down. And you can't do anything about it. You let it fall, because that is what you're training for. And I think now when it comes to moms who are going through these big changes, trade-off is a concept that they still have yet to understand, because you want to be a present mom, but being a present mom, the downfall is that your career is going to fall back.
That makes perfect sense.
And it's a sad reality.
It makes perfect sense.
And that's a sad reality for moms. Then it comes to a mom thinking, maybe I don't need the help. I just need to hold on and then I'll get better. And when the child is older, whatever I'm going through will disappear.
Oh. Tough one.
How do we talk to that mom?
Because it might not. Similar with general depression. Some people get depressed and it goes away without doing anything, right? So with postpartum depression, the trick here is you are dealing with another human being to raise. So it puts them at risk of their emotional and social development, their well-being. So when you are at your best, it benefits them. So that's why we advocate for seek professional help.
And I think, I think the other thing that I've noticed in our Black communities, people don't know when they're going to see a clinical psychologist what they're going to talk about. They're like, I must be coming to you. Because to her, she's probably sitting there like, yeah, I am sad. I know I'm sad, but why am I sad? See, I feel like they don't know when they're coming to you. What exactly am I supposed to enter that room and say? Must I just go like, I'm sad? No, but you know, it's the truth. It's the truth.
The way you're saying it's even more informed, because when you have a first session with someone from rural areas or whatever, they don't even have that type of insight of I'm sad, I'm going there because I'm sad. In most cases, they're being referred that they don't even know why. So they get here like, no, doctor, like it. You see? So yeah. And through my training, I've learned to, let's start with, are you here voluntarily? Do you want to be here? Do you know why you are here? I'm a psychologist. Do you know what we do? To what extent do you know? So that I can know where to start.
Yeah.
And the most recent responses were, oh, my idea of psychology, I see it on television. But at least it's something.
Hi, they're being honest. No, therapy is, I feel like it's something you find for, I don't like to say educated people. That's just seems like a wrong approach. But you find it in people who, there has to be someone in their family who's exposed themselves into it. Or else, it's going to roll around. It's going to roll around. And now, let's say you finally, the mom who's sitting down now is like, I think maybe I do need that help. What would be that therapeutical approach for them to, once they're in that office and they started now to get the help, what is that therapeutic approach they will be taken through?
Okay. So with therapeutic approaches, as psychologists, we all have different school of thoughts. Everybody punctuates from their own school of thought. But it mostly depends on where the patient is at and what they need the most. I'm sure we don't function the same. If we were to go to the same therapist, they might use psychodynamic with you. They might use CBT with me, whatever. So depending on what are the psychological etiologies of that patient. For instance, if the patient is a perfectionist, they are high functioning, a perfectionist, they feel they're not doing enough and whatever. They have these automatic negative thoughts of I'm not good enough, blah, blah, blah. The therapist could go the CBT way to say, let's restructure your way of thinking. Let's reduce your magnification of problems and all that. But with an individual who comes with mostly social problems, the baby daddy is not supportive and all that, we might take a more family systems approach so that we can work towards restructuring the family to be more supportive to the mom.
Yeah.
And if maybe a mom is struggling to provide emotional presence to the child, to be there for the child, to also bond with the child.
Yeah.
Maybe due to past traumas, we might go the psychodynamic way to say, let's explore what happened to you when you were 9 and all that. So depending on what the mom is bringing and their history, it's gonna be different.
Then let's say now with a mom that needs medical approach, and that is not for medical condition, but specifically for the diagnosis of PPD. I know a lot of people don't like taking medication. Antidepressants are not nice.
Okay.
In a way that it really changes your mood. But now, how do you then encourage some moms to, look, this is the approach, but also this can help you in the long run?
Yeah, that is a very challenging aspect in our field, to psychoeducate patients about the importance of taking psychiatric medication. And sometimes I'm just sitting thinking, especially when I'm working with a high functioning individuals, for me to term it psychiatric, it already puts a stigma on it. I not or a psychiatric.
I was about to that's why I because I know a lot of, when you go to a clinical psychologist, you feel comfortable.
Psychologist.
Yeah, psychologist. We not, there's no stigmatizations on that part. But now it moves very differently when you start saying, let's go to a psychiatrist, because they know it's medication. So how do we deal with that part?
With that partner, in my experience, it requires the formation of good rapport with the patient.
Wow, that's
with some patient, you can see from day one, they accept their diagnosis, they're okay with it, they understand. Like you were saying, if there's somebody who's been exposed at home, they can say, my aunt was taking psychiatric and she's fine. So already the person is open to the idea of taking the medication.
Yeah.
But if you're dealing with somebody who's the stigma, they take things too hard, take things personally and all that. Abantu bazotini syndrome as well. It becomes very difficult to encourage them to be open to psychiatric medication. But the best thing is to form rapport, and you also psychoeducate about the importance of psychiatric medication. For instance, if somebody had PPD from the first child and they're at child number 4, what are the chances that the chemicals in their brain are all over the place? They definitely need assistance and medication. So you just speak about it in a way that they get it. Or these will help balance my serotonin and whatever. And then hopefully I'll be fine soon.
So are there any red flags loved ones should be aware of that might indicate that a mom is going through, or actually a mom really needs immediate professional help?
Immediate professional help. So the symptoms that I've spoken about, also looking at the duration. It's been 4 months, 6 months, there's no change. This person seems to not want the child close to them. It's been 6 months. What could be going on? And maybe iterations about wanting to harm themselves.
Yeah, I was about to say you spoke about that part. I feel like it's good to highlight it again.
It's a huge red flag. And also iterations about harming the child. Yeah, that they really should seek for treatment or professional intervention as soon as possible.
And I think that part, suicidal thoughts. I don't think I've tried to find stats, but there's not enough stats really written about it because nobody ever reports it. And I think sometimes, if you start hearing a mother says, I don't want to be here, I don't want to be alive, that's a red flag. I feel like as a family, you need to do something. I always say, rather be safe than be sorry. Okay, and then let's hit with the myth now. We talked about the misconception. Let's start with the myth. This is the biggest myth I've seen when it comes to mental health. And it's a black thing. But it's witchcraft, guys. This person has been witchcraft. That is why this person is acting the way they're acting. That for me feels like it's one of our biggest myths when it comes to mental health. It's dismissing the reality, and it's saying that you cannot, like a person can't get help, which is not true. I don't know, what is your input on that?
Yeah, the dismissal part is very, very important. When we start saying, no, this person was happy during their pregnancy, their husband is here, we are also here. How come is she depressed? The fridge is full of food. Why is she depressed?
Yeah.
It means bamoloya. It dismisses the fact that they are human and they are susceptible to any other condition. Because would we say the same thing if they were to develop diabetes?
Never. We would never. We are dehumanizing people in the process of, instead of getting them help. Now, how do we talk to family about that?
So in that case, we would go back to your family systems therapy, where you are not only working with the patient who's been brought in, you are also saying, let's work with other subsystems in the family. Like if you're a young mom, your parents as the subsystem, your other children, for instance. Let's work on your marital system, you and your husband, so that psychoeducation can penetrate them. They can understand that these things happen.
They happen. Yo, there's some mom now probably holding her baby, crying, and it's like, yo, I'm going through this. This is what this is happening to me. What would you want to tell that mom?
So when the mom already feels that this is a lot, this is happening to me, and they already have an idea, it could be depression. I would like to say to them, it's good that you are even giving it a bit of a label, even prior to diagnosis, because when you give it a label, then at least you are taking out some other unnecessary factors, or maybe or maybe it's nothing, it will go away. So once you say it could be depression, then when it's depression, what else can you do? Maybe seek for support, because now it's immediate. Can somebody drive you to the clinic, your nearest clinic, for possible screening, mental health screening? Can somebody take you to a private mental health practitioner, even if it's not a psychologist, registered counselors, social workers, you see, and also get a diagnosis. Once you have a diagnosis, then you have the power to treat. Now we know what we are working on. So be brave, own the power of treating your mental health, own it up to yourself, and get help.
Claim your voice.
Yeah.
Hi, this was such a nice talk.
We did have a nice talk. I speak like a mom, ne?
You speak like a mom. Listen, man. You talk like a mom. I'm like, my baby, I'm here for you. No, but that's just the thing. I feel like if you're speaking something in a calm and, open way, it touches someone and somebody will take that step, because I really always advocate that therapy is the most important tool every mom must have access to. You will enjoy having your child. You will enjoy having yourself, because there's a lot of loss in there. There's a lot of self-loss in motherhood, and it's unfortunate, but there is. And I feel like it's our responsibility to not sell an image that is false to moms, so that whenever they are ready to, take that step, they would really want to take that step. Your mind will be ready. You'll be ready for whatever that comes away. Because even since Penny was saying the other time she was here, is that before you become a mom, you need to think about the systems that are going to work for you, especially if you're going to become a working mom. So yeah, that's just that. What would you like to close our episode with? Your final words of encouragement?
Firstly, as an aunt, I'm a deputy mom and aunt. I've learned so much with this interaction, hearing from you as a mom, Wawan, the preparation. Like you need to get prepared and all that. So that I don't form part of the statistics and stuff. But also, I just feel like as moms, it's okay to or admit to yourself when you're going through too much. And it's okay to admit that this could be depression. It could be psychosis. This is even light. Postpartum depression is light. Postpartum psychosis is the worst.
The big man.
Admit, it's fine, admit and seek social support, and seek professional help. We are all over the place. Do knock at our doors, guys. We are here to help.
Thank you.
Thank you.
Thank you so much, guys, for joining us on our discussion. I hope you don't forget to subscribe, like, and share, as well as comment, and have an amazing day.